So, Dr. Paul here. I want to talk about a subject that probably really the most common subject I see in my practice, which is anxiety disorders and how they present. Again, this is more common than depression. It's more common than anything I see. It's very misunderstood, and most doctors don't really understand the symptoms to look for. I mean, the most obvious is if someone's having an anxiety attack or a panic attack, which is basically miserable. You feel like you can't breathe, your heart's racing. Some people think they're having a heart attack, they panic, they're sweating, they're shaking. Miserable thing to go through. So that's probably the worst part of it, is having an anxiety or panic attack. But then there's a lot of other things. But some of the symptoms I just said, when you have anxiety, it really affects the breathing. And what happens, I think, is with breathing is people they don't take deep breaths. They start shallow breathing, and then they start to feel like I can't breathe. Well, the problem is they're not breathing properly, and this is why when I tell people when they have anxiety, slow down your breathing, stop the hyperventilating, slow it down, take a deep breath in, hold your breath, blow it out slowly all the way. Let it, and so if you start to do that slow in, slow out, and do that over and over again, that can really help with anxiety. Also, moving your body, because sometimes just moving the body, going out and taking a walk can help too. But also, there's a lot of physical symptoms. So the things I think that people don't understand is how physical anxiety is. For example, muscle tension. So the most common symptom I see is right here. And I think most people can relate, like these muscles, the neck, we call the trapezius muscles, the upper back, the shoulders. This area is where a lot of people store their stress. And a lot of people think it's because I'm on the computer all day. And a lot of people, a lot of massage therapists will actually spend the majority of their time in that area because it's so tight. But it's not only that, it can be headaches, it can be stomach aches. So a lot of people with anxiety have stomach problems, or they have cramping and bloating and diarrhea, and or fibromyalgia. So a lot of people hear this condition, which is kind of, we call a mystery illness, because there's no blood test for it, but there's scattered joint pains around the body for no apparent reason. And so there's kind of put a diagnosis of fibromyalgia, but then what do doctors do? They give people, they say, well, take an anti-inflammatory and here's a muscle relaxant, and they surface treat things. There's a lot of surface treating of symptoms, and not stopping to think, well, what's causing these symptoms? Is there what's underlying in the person? Why are they getting it to begin with? And I think there's way too many doctors that don't ask those questions. And I call Band-Aid treat. They treat the Band-Aid. They give Band-Aids to treat the symptoms. And then like I spoke about, irritable bowel syndrome is what I just was mentioning. When people have bowel symptoms, acid reflux is another one. Which is heartburn. And a lot of people, again, the racing heart and the chest tightness, and a lot of people end up in the emergency room, and they end up they're thinking they're having a heart attack, and then they're checked out and everything's fine, and then they're sent home, and then they're told to go see their doctor, and then they sometimes go to see their doctor and tell them about it. They go, well, you're fine now, right? Well, yeah, but so if the doctor doesn't dig deeper and try to understand what's causing these symptoms, and that's what unfortunately is misunderstood. This has been the kind of the hallmark of my practice for over 30 years now. Is when I started really understanding anxiety in the first years of my practice, and I started understanding the medications and how they work and how they balance the chemicals in the system that relieves the anxiety, and that was the breakthrough for me that really got me interested in this field of medicine. Is when I started to see these hidden reasons, and the hidden reasons meaning. These are things that you can't do blood tests for. You can't do a scan. You have to listen to people and ask them, do you feel good? Do you feel like yourself? Do you feel, and then when they say no, you have to really dig deeper and find out, when did this start? and treat it. No, don't be afraid of treating it. And if you have a doctor that's not treating it or not taking you seriously, you got to find someone who is taking you seriously. And if you can't find that doctor, contact my office and I can help you. Because this is something I do every day. I've done it for a long time, and I'm very sensitive to the treatment of it because it's so common and so misunderstood. And it's I like to see people getting the treatment and then to me, there's no greater joy in my practice than seeing people's anxiety going away, and because people suffer so long with this, and then when they finally find a solution, they're so relieved. So anyway, thank you for listening.